Hello, everybody. Pleasure to be with you here today for this webinar put on by the Cybersecurity Leadership Council of the Salt Lake Chamber. First of all, I want to just thank the Chamber for giving me this opportunity. My name is Earle Foote. I am founder and CEO of Nexus IT Consultants here in our offices in beautiful downtown Salt Lake. Quickly, Nexus IT is a 22-year-old IT support and services firm. We specialize in white glove outsourced IT support, cybersecurity, compliance, and cloud technologies. Today, we're going to be talking about the world of IoT, or Internet of Things devices, as they apply to healthcare. So without further ado, let's get started. Many of you may have heard of IoT in the past. Many of you may know what it is, many of you may not, but IoT is somewhat an emerging arena of technology that has emerged over the last several years. It's made up of smart and wearable devices, and it's estimated by the year 2025 that there will be approximately 64 billion IoT devices in use throughout the world. So what are IoT devices then? IoT devices are smart devices that are internet connected, internet enabled, or capable of connecting to a network. Many of you have these devices, and you may know that you have them, or you may not know that you have them. You may use them in your personal lives. You may use them in your businesses, in your healthcare practices. These are devices like smartwatches, smart medical devices, thermostats, smart appliances, smart assistants like Google Home and Amazon Echoes or Alexa, security cameras, and so many other devices now that are internet connected. These devices can pose a risk because they do track user habits and preferences, but they can also help consumers and businesses automate tasks and streamline customizations of your environments where they integrate with technology. As of last year, in 2019, 87% of healthcare organizations have introduced IoT into their operations. That's pretty significant. 80% of healthcare organizations throughout the United States are using IoT devices in some way, shape, or form. While there are so many benefits to doing this, there is also there's massive risk to security, particularly when these devices are not added in a thoughtful way or planned out how they're going to be added and kept secure within your environments. So we're going to talk a little bit about that today. One of the reasons that these IoT devices pose such a threat is that, for the most part, they are released with pretty minimal or non-existent security features. There's not a lot of forethought by the manufacturers that go into these devices. They generally, oftentimes, are shipped, particularly consumer-grade devices, are shipped out of the box with significant vulnerabilities already, available to be exploited by cybercriminals. Let's see, because IoT devices, connect to your network, whether that be through a hardline or through Wi-Fi. They are just like any other network device on your network, and any other device that is connecting to the internet through your network, and they should be secured in the same manner. Just as you wouldn't connect, another computer or some other internet-enabled device to your network, you should not do so with IoT devices without taking the proper precautions, the proper measures, and planning beforehand. So why do these IoT devices pose a risk? Because they can capture information that travels through your network. As cybercriminals are able to exploit these devices, if they are able to take control of them, which has and does happen actually on a very regular basis, and we will get into that in some more detail. Frankly, it's somewhat scary how often and how easily these devices can be compromised. Anyways, a cyber criminal can use those, the access to those devices then to control things that are happening within your practice or your office space, such as turning off refrigerators, alarm systems. They can mess with your thermostat. Again, they can capture information that's traveling through your network. PII, your patient data, patient credit card information, things like that can all be potentially exposed because you have devices like this on your network. It's also very common for hackers to compromise these devices and then use them to launch attacks on your network or on other people's networks. So they're used as the source of other attacks as well. According to Forbes, they said in 2019, IoT attacks surged by 300% and now measure in the billions of IoT cyber attacks per year. Kaspersky Labs, Kaspersky is an endpoint security or antivirus company, or they produce security solutions, security softwares. They reported a 10 times increase in IoT attacks in 2019 over 2018. Kaspersky also reported that 30% of these IoT attacks originate from China, 19% from Brazil, 12% from Egypt, and the balance from different locations across the globe. The HIPAA Journal reports that 82% of healthcare organizations have experienced attacks on their IoT devices. That's by the end of 2019. That's a fairly staggering number. 82% of healthcare organizations that have experienced attacks on their IoT devices. A couple of interesting quotes here. First by Tom Dolan, the VP of Forescout Technology. He says, "The healthcare industry specifically struggles with device-based threats, legacy devices, and the challenge of IoT or business-related IoT. Our data shows healthcare has the highest rate of legacy Windows machines, such as Windows 7, XP, and other legacy OSs, including those on IoT medical devices." And then Fabian Wosar of Emsisoft, the CTO there, says, "The fact that there were no confirmed ransomware-related deaths in 2019 is simply due to good luck, and that luck may not continue in 2020. Governments, health, and education sectors must do better." This is a real risk, and I certainly am not interested in being a doomsdayer, but a real risk of cyber criminals and hackers taking control of healthcare provider networks, either through IoT devices or other means, and then shutting those devices and or networks down completely. Obviously places patients at risk, particularly patients who are actively connected to medical devices. Again, most of these medical devices now are actually considered IoT devices because they are internet enabled, internet connected. They're on your network. And obviously that poses a significant risk to those patients. So let's talk about some of the best practices and some of the things that you can do moving forward to help ensure that IoT does not expose your practice, yourself, your patients, or your organization as a whole in any significant way. So first of all, if you're thinking about using IoT devices, I would recommend to not use consumer-grade devices. I'm seeing for me, what is an alarming trend in businesses that are using IoT devices that are made to go in homes and not made to be used in businesses, such as camera doorbells, security cameras, thermostats, all sorts of these great little smart devices that are fun to have, but frankly are not up to par for a business type environment. The security protocols, features, and measures that are taken on those devices are not up to snuff for what is needed within a business network. So all of those things pose greater threat to you and your organization. And if you're going to implement IoT devices, I would suggest looking for commercial grade counterparts to those devices. Password management is certainly one of the most important things you can do when it comes to utilizing IoT devices. It's extremely common for hackers to launch attacks and to compromise IoT devices because the user of that IoT device has left a default administrative username and password on the device. Most consumers are really not, frankly, well educated enough to say, I'm going to take this device out of the box, I'm going to install it, and then I'm going to connect to it and change that default username and password. And so mass amounts, I'm talking, millions, if not tens or hundreds of millions of these devices worldwide are sitting out there with default usernames and passwords on them, which make them extremely easy for cybercriminals to compromise. So the first thing you need to do is make sure that you change that default username and password, and then you need to set a unique, complex password. And I would recommend updating that password at a minimum every 90 days, but at least once a year, twice a year minimum would definitely be recommended. Network monitoring is another thing that you can do to help secure your IoT technology and protect you from the potential vulnerabilities that it poses for your organization. So the network traffic that these devices generate needs to be monitored. It needs to be under somebody's watchful eyes so that they can see what's going on, whether that is in an automated manner or it's manual. And so I would definitely recommend investing in a network monitoring solution or speaking with companies that do outsourced network monitoring, which would include whatever monitoring solution you look at needs to include the capability of monitoring your IoT devices and the IoT traffic. SOC and SIEM are technologies that help with this, and technologies or solutions that help with this. We'll talk a little bit more about those in detail. They have become quite affordable, and actually now for many regulatory compliance bodies out there, they are required. Let's see. Lastly, I would recommend that you do not allow employees to connect their IoT devices to your corporate network. I'm talking devices like their own smartphones, their smart watches, whatever device, tablets that they might bring into your office, whatever is owned by them, a piece of technology that's owned by them. I would not allow them to connect to your corporate network, particularly over the Wi-Fi. You can create a segregated network if you choose to, so that your team members can connect their devices to your to a guest Wi-Fi connection, but a guest Wi-Fi connection that is segregated from your primary corporate wireless connection. That will help in a significant way to keep any vulnerabilities that their devices may be exposed to, or if their device is potentially already compromised. It'll keep those cyber criminals and hackers from having unintentional backdoors into your network. Let's see. Let's talk about updates and patch management. So these IoT devices, as I've expressed, oftentimes come out of the box, honestly, quite vulnerable to being attacked and compromised by cyber criminals. And so as soon as the device is installed, you need to go to that manufacturer's website, find the latest firmware, which is the software that runs the device, find the latest firmware and patch the device, update the device to the latest firmware. But that needs to be done on an ongoing basis. These IoT devices, new vulnerabilities are discovered or exploited within them every few weeks or every few months. And so at minimum, I would recommend monthly or every 2 months in worst case scenario, downloading the latest firmware for that device and applying it. Sometimes the devices, if they're higher quality devices, are going to have a wizard within the device application. So if you have an app on your smartphone to run that device, or if you're able to access it through a web browser, sometimes they're going to have a little wizard there that will help you download and install that latest firmware and do it on a regular basis. Again, I definitely would recommend monthly. All right, so moving on, I said we'd talk a little bit more about SOC and SIEM. So a SOC is a security operations center. It is a team of individuals, and anymore, you can now outsource this sort of a solution and scenario, again, for reasonably affordable prices. And so a SOC team will keep an eye on all of the activity and traffic on your network. They'll monitor what's going on 24/7, 365, around the clock. They're looking for suspicious activity, suspicious traffic. They're looking for anything that not only on your IoT devices, but across your entire network, any of your connected devices. They're looking for anomalies that may look out of place, so that they can dig into those, understand what they are, and then shut them down if need be. SIEM technology is actually a tool that is used by SOC teams. So SIEM is generally it's an AI-based tool that helps parse through logs of all of your network connected devices, including your IoT devices. So when you're talking about dozens or hundreds or even sometimes thousands of devices that might be connected on a network for a healthcare facility, the amount of traffic and the amount of logs can be insurmountable for any human to stay on top of, to keep eyes on. And so SIEM is a technology that helps parse through, dive into all of that information, and look for that those anomalous pieces of activity, and then alert actual humans about what it's finding, so that the humans can dig deeper and then take action, to protect organizations from a potential threat. So SOC and SIEM, very good solutions that are available in the fight against, keeping your IoT secure. Certainly something I would recommend. We want to talk a little bit about firewalls. Firewalls provide an extra layer between the public connected world, between the internet and your network, and those IoT devices. And having a robust commercial grade firewall, generally today's firewalls are going to utilize what is called UTM, or Unified Threat Management. Essentially means the firewall is doing a lot of advanced threat type of analysis and taking action upon it automatically. Some firewalls now use AI. If they see anomalous activity or potentially malicious activity, they will shut that down. So again, here I would recommend, do not go buy a home grade simple firewall from a big box store. You need to be looking at commercial grade solutions, particularly, if your business is 10 users or more, if your healthcare clinic is 10 users or more, you absolutely need to have a commercial grade firewall. And you need to be thinking about how you're being a good steward over your client's data, your patient data. Certainly the HIPAA regulation requires that. And it's having a robust commercial grade firewall with UTM technology is part of that whole effort to be good stewards of the data that you store, that you house within your network. On your firewalls, you definitely should be, again, using using complex passwords. Those passwords should be updated on a regular basis. Again, a recommendation of a minimum of every 90 days. And you should be updating the firmware on your firewalls. Firewalls are like IoT devices. They're built and sent out, shipped by manufacturers, released to the public, and sometimes there are vulnerabilities in there that months down the road, cyber criminals find, they exploit, they hack them. And so your firewalls, you need to keep that firmware up to date. That should be at minimum a monthly effort, checking to see if there is an updated firmware for that firewall and applying that. Part of UTM technology for firewalls also includes IDS and IPS. Those mean intrusion detection and intrusion prevention. I kind of got my two words crossed there, but intrusion detection and intrusion prevention systems. So this is somewhat similar to SIEM or SOC technologies, but it's an automated sort of thing that happens at a firewall level. It can be configured as well to email and alert, physical human beings so that they can get eyes on it and see what's going on. But IDS, IPS is definitely something that should be used on healthcare networks, so that you understand the traffic that is moving in and out of your firewall and the traffic that is hitting it and trying to get into it. That traffic should be inspected. You should understand what it is. You should know if there is malicious traffic there that is trying to compromise your network, or in some scenarios that has already compromised your network. So those are definitely things that I would recommend for keeping you safe, particularly when you're using IoT devices in your healthcare networks. So there's a lot of complex kind of ideas that we've talked about here today, a lot of complex solutions. I realize that some of the attendees or the guests of this broadcast are going to be small medical clinics with maybe 5 people in the organization, some with 20 or 25. A lot of medical clinics that don't necessarily have IT experts on hand, on staff. And so if that is applicable to you, I would definitely recommend that you reach out to IT experts, particularly security experts, on how to correctly secure your healthcare network to make sure that you are being good stewards of your patient data, that you are doing your best to keep that data from being compromised. Honestly, it's a fairly complex endeavor, and oftentimes it does require a professional to get involved to help with that. Anyways, that's what I have for you today. I want to thank you for your time. I hope that there's been some valuable information for you here. I realize that the information that I've provided today is quite cursory. There's a lot more that we could get into more in depth. So if you have additional questions, if we can help you in any way, our contact information is on this last slide. You're certainly welcome to connect with me on LinkedIn. Just look for Earle Foote, CEO of Nexus IT. We consistently have ongoing content that we publish, on social media and on our blog, on our website. We have security-related content, tips and tricks that go out on a regular basis, and so keep an eye on that. Anyways, it's been a pleasure.